Hi friends, today's our topic is infertility. So in this video I am going to discuss about the definition of infertility, the causes of male and female infertility, symptoms and the management. So we'll move on to the video. Infertility in human is the inability to conceive after 12 months of unprotected sexual intercourse without the use of birth control. Infertility could also mean the inability to carry a pregnancy to full time. This means a woman gets pregnant but keeps having miscarriage or stillbirth. About 20 to 35% of infertility cases stems from the woman. 20 to 30% is traced to the men, and rest of the time it is caused by combined problems in both partners or due to unknown causes. About 8 to 12% of couples worldwide experience infertility problems. Oftentimes, the factors that cause infertility in couples are present at birth and at time they develop later in life. Next, we'll discuss about the cause. So, first we'll see the causes of men infertility. The milky juice that a man releases during ejaculation is called a semen. This semen is made up of sperms and fluids. Usually the sperm is produced in the testicles and the fluid comes from the prostate gland, the seminal vesicles and from the sex glands. Usually the main causes of male infertility is due to low sperm count. A low amount of sperm is ejaculated. A sperm count that is below 15 million is considered as a small. The next cause will be abnormal sperm. The shape of the sperm is unusual, making it difficult to move and fertilize an egg. Another cause will be low sperm motility. The sperm cannot swim well and therefore cannot reach the egg. The above problem can result from some medical conditions such as diabetes, cystic fibrosis, mumps and hypospadiasis. Sexually transmitted diseases such as gonorrhea, HIV and chlamydia. Unhealthy habits such as excess alcohol consumption, illegal drug use, anabolic steroid use, which is popular with the athletes and bodybuilders. Smoking, testosterone supplementation can seriously reduce the sperm count and motility. Exposure to chemicals such as lead and pesticides. Overheated testicles, which can be caused by varicocele, that is a condition in which a veins on a men's testicles are largely making them overheat. Undescended testes, a frequent exposure to heat that may result from wearing tight clothes, working in hot environment or the use of hot tubs and saunas. Age, overweight or obesity also a cause of male infertility. Mental stress, especially if it leads to reduced sexual activity. Cancer treatments such as chemotherapy and radiation. Structural problems such as injury to the reproductive organ or blockage in the testicles. So these are the main causes of male infertility. Next we'll move on to the causes of infertility in women. In women, to get pregnant, an egg must be released from one of the ovaries. It should be fertilized. The fertilized egg must go through a fallopian tube towards the womb and attach to the inside of the uterus. Infertility in women arises when there is ovulation disorders which affect the release of egg from the ovaries and is the most common cause of infertility in women. An ovulation disorder can result from polycystic ovarian syndrome, that is PCOS. Next cause is premature ovarian failure, where the ovaries stop functioning or fail before the age of 40. Other cause will be the poor egg quality, thyroid problems, hyperprolactinemia, chronic conditions such as AIDS or cancer. The next cause is uterus or fallopian tube abnormality. This can prevent the egg from moving from the ovary down to the womb. This abnormality may be due to surgery which include pelvic or cervical surgery. Another cause will be endometriosis. It is a condition where endometrial tissue lining in the uterus grow outside of the uterus. The next cause will be uterine fibroid, especially submucosal fibroids, where benign tumor occurs in the uterine wall. Sexually transmitted infections such as chlamydia can damage the fallopian tube. Medical conditions such as lupus, poorly controlled diabetes, amenorrhea, that is absence of menstruation, and genetic abnormalities are the causes of female infertility. Additionally, age, alcohol use, being overweight or underweight, and smoking are the causes of infertility. Besides that, exposure to certain chemicals such as lead and pesticides also can lead to infertility. So these are the causes of female infertility. Next, we will move on to the symptoms. The major symptom of infertility is the inability to conceive. At times, an infertile woman may have irregular or absent menstrual periods. Here we discuss about the diagnosis and treatment. Diagnosis in men may include semen analysis, where your semen is collected for analysis in the lab. Blood test to determine the level of testosterone or any other male hormones. Genetic testing to check for any genetic defect that may be causing infertility. Diagnosis in women may include blood test to measure hormone level to determine the ovulation. An imaging test to look for uterine or fallopian tube diseases. Ovarian reserve testing to determine the quality and quantity of egg available for ovulation. Next diagnostic test will be hysterosalpingography to check the condition of the uterus and fallopian tube and look for any blockage and other problems. Here we reach the treatment aspect. Treatment in men include improving lifestyle and behavior, medications, surgery, and sperm retrieval. Treatment in women. Fertility drugs may be used to regulate or induce ovulation. The blockage of fallopian tube may be repaired by surgery, making it easier for egg to pass into the womb. Intrauterine insemination. At the time of ovulation, healthy sperms are placed directly into the womb. This procedure is done when men has a low sperm count, low sperm motility, or when the causes of infertility is unknown. Assisted reproductive technology. A procedure where eggs are surgically removed from the woman's ovary, then combined with the sperm in the laboratory and are returned to the woman's body or donated to another woman. The most common type is in vitro fertilization. Other types include assisted hatching, gestational carrier, intracytoplasmic sperm injection, that is ICSI, and donor egg or sperm. So these are the management of infertility in females. Here we can wind up our today's section. In this video, I have explained about the definition of infertility, causes of male and female infertility, symptoms, and different managements. So in the next class, we will meet with another episode of midwifery topics. Till that, take care. Bye-bye.